Okay. Okay, this is a 15-year-old young man from Canada who we're going to start today. His tics began at 10 years old with his motor tics, and then his visual tics began, what, at 11? Did he tell me 11?
About 11 the year after.
11 and a half.
The vocal tics.
Vocal tics began, and we're going to have great success with him because we've put in our tongue blades and just brought everything to a screeching halt. And you did that last night, right? And how many tongue blades did you determine stopped it?
It seems that 5 is good for him.
5 is good for him. Okay, we'll have the appliance back tomorrow, I believe, and we'll put it in, and we'll start at that height or close to it, and just go from there. And we'll make you an upper appliance to take care of his cranial compensations. Right? We agreed on that yesterday, I believe. Okay. And I'm expecting very good results from this right away. This shouldn't be too difficult.
Yeah.
And you remember our agreement, right? Our deal?
Oh yeah.
Okay. Good. Okay, that's all for today. Okay. Okay, we're going to start treatment today. This young boy. It happens to be 20 minutes after 3. We're going to fit him with this lower mouthpiece for this movement disorder. You can see all these Tourette symptoms he's got going. And we're going to realign his mandible to his cranial base using this mouthpiece. This is a substructure for it, which the laboratory has fabricated for us overnight. We're mixing soft acrylic now, and we're going to put a new surface on it. We've determined that the vertical dimension we're going to start with is 5 tongue blades high, because we have given him tongue blades to experiment with last night, and he's been varying the tongue blades up and down in his motel room, and he's determined that 5 is a good starting point for him. Okay, give me this here.
It's perfectly.
This goes on all day long. Good and thick. Focused in on here now. I've just added a bolus of acrylic to the left side, to the right side, and I'm adding some to the left side. Now this awful tasting stuff is approved by the United States government. So if you don't like the taste, most people don't, you write Obama, okay? Except Obama's over in England right now, having tea with the Queen. Give me those tongue blades. Like that. Right? That's enough. Just there. That's it. Okay, open. Close lightly on. Okay, good. Open now. Give me a scaler. Open, don't close. Okay. Rinse out. Okay, you can take a break now. Okay, this is a last piece of paperwork. This is to make you an informed consumer and keep me out of jail. Diagnosis of deep bite, misaligned mandible, and Tourette symptoms. We're starting off with upper and lower mouthpiece. Other options of treatment include no treatment at all and medications by your physicians for symptoms. If your therapy by now doesn't work. Okay.
The alternative.
Yeah, so if you'll just initial those three things. Do you all have any questions?
Nope. Oh, I think we're just hoping for success.
Let's make it work.
Okay. Where are the 5 sticks? You got them? Okay. Dr. Lou, why don't you treat this patient? Come on, come on. You can do it. Okay, let's just get some idea. Open. Wait. Is that about the height? That height feel familiar to you?
Yeah.
This wouldn't come off of that for a minute. I thought we were just going to have to send you home like that. Okay, old line. Lift up. When you're old like me, you don't like to bend over so much. Right. Okay. Is that hurting you in any way? Digging into your gums in any way?
Nope, none.
Hurting your teeth in any way?
Nope, none.
Okay, both. Mix. Okay, just look in the camera. Okay, I just put in his mouthpiece a moment ago. Open. Please slide back in the chair. Okay. I just put in this boy's mouthpiece a moment ago. Wait. Yeah. And you can see the degree it opens his mouth. Wait. Now. And he's going to sit here with it for a few minutes while all of his nerves and muscles quiet down. And then I'm going to adjust it. And then we'll send him on his happy way. Now you eat with this, okay? Gotta eat with it, sleep with it, kiss your parents goodnight with it, all that good stuff. Do your homework with it, everything. 24/7 means 24/7. Okay. He may have a... Okay. This patient returns after having had his lower appliance 17.5 hours. He's been wearing it. His movement disorder has not been eliminated. It's just been reduced. He reports that he's had this best night's sleep ever last night, and we have great hopes for his continued improvement as the days go by. He'll be getting his upper appliance at his next visit, because it'll be constructed by the laboratory between now and the next visit that he comes. Do you want to say something for the viewing audience? Tell them how you feel.
Good. I feel good.
So they feel more relaxed?
Yeah.
The urges to that you've been experienced before, how are they?
They're less.
Less, okay. Can you put a figure on it? Like, are they 30% less, 50% less, 90% less?
Well, it's 60% less.
60% less, okay. Well, that's pretty good for 17 hours. This improvement will continue as time goes by. So, that's pretty good for a 15-year-old kid, right?
Yeah.
Okay. Okay, you want to... This patient came in after wearing a lower flat appliance for the past 25 days, which essentially resulted in no improvement. His tics continued the same, if not more, than when originally seen. Today we have put in an ALF appliance in his maxillary arch and cemented it in place, and converted his lower appliance from a flat appliance to a repositioning appliance to move his mandible forward to take pressure off his temporomandibular joints. This has greatly decreased his tics, and if he perseveres in biting into the correct position that we have dictated for him, his tics should start to diminish very noticeably, very rapidly. Do you have anything to say to the viewing audience?
No.
You feel less urges with these changes we made today?
I just feel normal.
You feel normal? Huh?
Yeah.
Okay. Well, that's good. Okay. Okay, that'll be it. This young man returns the next day, 24 hours after receiving his upper appliance and getting his lower appliance repositioned. And according to his mother, he's had a 40% reduction in his tics in the last 24 hours. And he comes from very far away, and we're going to have a local dentist maintain the appliance in this position by refreshing the acrylic. And if that can be done adequately, then this boy's tics should diminish over time. It should be probably totally gone within 10 or 12 weeks. Okay? Let it tear loose for the camera, okay? I mean, what comes natural?
No. No. No.
Okay. Things calm down a bit?
Yeah.
Okay. That's